Find some decent lighting. Have you ever had that friend who you love spending time with them, you enjoy their company, you want to go out to eat, but you know that you're going to be picking up the tab? Now, it's not because your friend is cheap or whatever. It's because maybe they don't make as much money as you. You want to go somewhere specific. You want to go somewhere really nice. And you know that you don't want them to be under pressure to pay their share. So you're like, you know what? I don't even care. I just want to take you out. I want to spend some time. We haven't seen each other in a long time. And so you say, dinner's on me, right? And you're willing to accept that you're going to pay twice as much for the meal, because you're not really paying for the meal. You're paying for the experience. You're paying for the time with your friend. You're paying for, the memory that you're creating. Now, I'm going to tell you right now, a lot of you are doing this with Medicare, and specifically on the evaluation. So stay with me and let me bring this full circle back to what we're talking about. So last night was one of those rare nights that I was actually stumped for a solution. I don't get surprised that much anymore, so it's always a welcome, experience when somebody shows me something. I'm like, I have no idea. I just don't know. I was talking to a therapist. She is, and I'm not going to name names, but you're welcome to identify yourself. She is an outpatient neuro-based therapist who focuses on mobile therapy. And we were talking about, she's in my zero to paid Medicare course, and so we were talking about reimbursement, and she said that she spent 90 minutes doing an evaluation with a patient and could barely justify one additional unit of treatment. And I was just floored. I was like, how can that possibly be? How can somebody spend 90 minutes and not justify more than maybe one unit of treatment? And then she showed me the documentation. She showed me everything that she did, and I was genuinely floored. I was at a loss for words. I had no idea what to say. The quality of the documentation was at such a high standard. There was so much technical knowledge and so much that was done. Now I can understand how something like that took 90 minutes. But my thought process, and it took me like 24 hours to figure this out and come up with something, was like, there's just something wrong here. There's this insane value. And I told her, I said, look, this is not a Medicare evaluation. This is a $500 evaluation. This is 90 minutes that should have been spent, or should have cost not $500, should not have been paid for by Medicare, or maybe paid for in part by Medicare. But this is a $500 experience that you gave away for $82, or whatever the Medicare coverage was for the eval. And I'm trying to reconcile this in my head, because I know there are a lot of you out there. I know you're overachievers by nature. That's what brought you into the profession, and you want to do above and beyond, and you want to be the expert in your field, which is amazing, and I'm happy for you, and I want you to be that, but I want you to do that profitably. And so throughout the night, throughout the morning, I've been treating patients all day. I'm taking a break now. I'm waiting on my next two to come. I've been thinking about this and I came up with a couple of scenarios, and if you guys stay with me, we can kind of work through this. And I would love to hear your suggestions on what you think, how you handle this. You do this high level evaluation that's worth $500 to $1,000, and then you give it away for $82. That's my disconnect there. And so on the one hand, I was thinking initially, I was like, well, therapist just needs to make some hard decisions. They need to understand, you can't sell a high value product that costs you 7 years in school and 20 years of experience and all that other stuff. You can't sell it at that much of a loss, right? There's a loss leader, and we'll talk about that in a minute. But you can't sell a $500 product for $89 and expect to stay in business. So I said, well, she's going to have to make some hard decisions. She's going to have to say, well, I just need to lower the standard. But that doesn't feel right. You guys don't want a lower standard. I don't want you to have a lower standard. So I'm like, okay, what else can we do? How else can we address this? So I thought, well, let's talk about loss leader. Let's talk about those retail stores. Kroger gets a gallon of milk. I have no idea. I'm just making this up. The gallon of milk costs them $2. They sell it for $1.50. They stick it in the back left corner of the store because Kroger knows that $1.50, they lose 50 cents, but that's gonna end in a $75 cart value because by the time the person gets to the back of the store and back to the register, they loaded their cart up. So if this individual, if this therapist is gonna sell or give away a $500 evaluation for 82 bucks, there better be some major upsells. There better be lifetime value in this relationship so that they recover that expense. Because basically you're saying $420 is the expense to acquire that patient. There better be some big lifetime value in that exchange. Okay, so that's one option. A little more creative, probably less practical, is I was thinking, if you guys ever see me do an evaluation, and I hope to share some of my evaluations and my experiences, and I'm the first one to say, I'm not doing neuro. If I get a patient with a neurodiagnosis, I'm referring out because that's not my skill set. But typically for me, 5 or 10 minutes of back and forth communication, getting to understand a little bit about the person, then we're jumping on, into the program. We're gonna start moving. We're gonna do stuff. And I will continue my evaluation and my assessment through movement, through activity. Let me see you get up. Let me see you sit down. Let me see you move. Let's do 5 of them now. The first rep was eval. The next 4 reps is exercise, right? And that's just in my nature. I mean, I just like to get moving. I wouldn't want to sit there for 90 minutes answering questions and having somebody do that thorough of an assessment for me, but I'm not the patient, so I understand that. So my second thought was, okay, it's not a loss leader. Maybe instead what happens is she actually hires me or you or somebody else to provide a covered evaluation, to provide what Medicare is actually paying for. And of course, now we can do it through telehealth, depending on state guidelines and Practice Act. But in theory, I could do the covered eval in 10 minutes. Then she could do the far more comprehensive evaluation for self-pay services. Medicare pays for my part of the eval, the patient pays for her part of the eval. This way, we kind of both meet in the middle. Now, of course, in that scenario, you could say, well, Tony, why would she give up the $82 reimbursement? There's no reason. She could break, and this is what I've settled on, for those of you who want to provide that highest level experience, right? There's standard of care. Profession-wide, there's standard of care. And then there's your standard of care. And I pretty much guarantee your standard of care is far and above the profession standard of care, okay? So what I figured out was you say, okay, Mrs. Patient, this is the part of the evaluation that's covered by Medicare. This is what they will pay me to do. I believe you need this, which is 3 times more than that. So if you like, I can do that. And it's covered by Medicare at 100%, 80% by Medicare, 20% by the secondary. Or we can do that, and we can also do this, right? And this is where you get into the comprehensive evaluation. And I think of that in terms of like a family doc, right? If I go in to see my primary care with shoulder pain, he's gonna look at me, maybe test a couple things, and give me a diagnosis. Okay, that's what the insurance paid him to do. Now, what if I went in with the expectation that I want an MRI, I want a CT scan, I want a urinalysis, I want a fecal analysis, whatever it's called. I want blood work. I want you to look at these markers, right? I want a brain scan in case it's a tumor. I don't know. Like, you can always do more. I'm not saying it's right or wrong, good or bad. I'm saying that if I am the patient who wants more, who wants the comprehensive experience, who wants above and beyond what the insurance is going to pay, I need to assume the responsibility to pay for more. If I'm looking to get what insurance pays for and nothing more, then that's what I should receive. And that's where we need to, again, understand your role in the marketplace. Most of you are not in this to make $10 million a year, and I get it. Most of you are in this because you're passionate about it, you love it. last little comparison I'll make, I always think about like, there's things at my kids' school. So they have an event every year. It's a festival, and so I come on for, I think, a 2-hour spot to help in one of the booths, right? Now, of course, it's volunteer. I'm not getting paid, but I always think like, imagine you were gonna get paid, you were gonna be hired to do something you truly love, that you would do for free. You don't care if they're paying you for an hour and you spend 5 hours there, because you'd be doing it no matter what. You know, and that's the way many of us approach patient care. We love what we do. I have people in my clinic all the time that are, you know, I'm losing money on, but that's okay because I love what I do. This is the equivalent of taking my friend out to dinner and me picking up the tab because I don't care about the cost. I want the experience. That is totally fine, and you can do that. But you have to do it intentionally, and you have to understand that that is the cost that you are accepting. And I would ask you to put some effort into figuring out how you can still make it a profitable endeavor in some capacity. So for this PT, for you, if you're the PT that's overachieving, that's doing 3-4 times as much as is minimally required, I would tell you to, 1, consider it a loss leader, but look for opportunities to make it up on the back end. Sell a comprehensive home exercise program, sell access to you through email, through other methods, sell some sort of continuity program, have some other cash driver that offsets the cost of that loss leader, or else the loss leader is just a loss. It's not leading to anything. Consider breaking the evaluation up into 2 components, the covered component and the non-covered component. You know, I think Medicare would say it's probably not necessary nor reasonable to be spending 90 minutes doing 50,000 different tests to come up with the best possible plan of care. They want a plan of care that's good enough. That's what they're paying for. That's what they should get. The patient should have the opportunity to pay for good enough and upgrade to premium. And then just, you know, recognize, okay, I'm making a decision that is not in the best interest of my business, but that's okay because I have enough. I'm happy with what I've got, and this makes me happy. You know, plenty of people will donate to charity. Plenty of people will donate to fundraisers and different things. This is no different. You donate because it makes you feel good to help somebody who is less fortunate. You doing that evaluation, spending 90 minutes, getting a teeny tiny reimbursement for the actual value, look at it as a donation contribution, something you're doing to benefit the other person because it makes you feel good and you're accepting the cost of that. So guys, let me know what you think. As always, like the video, subscribe to the channel, share it if you get the opportunity because we are like that close to monetizing this YouTube channel, which will go a long way into helping to support the content that I'm trying to share. As always, guys, I'll catch you on the next video.